Hello, good day to you all. My name is Dr. Kong. I'm one of the consultant physicians and nephrologists, and also I'm one of the co-founders of Elderlove and Missi Care. So I'm glad that I have the opportunity to share with you today regarding this topic, asthma. By no means my presentation is going to be a high-level one. I'm just going to give you a brief overview regarding asthma, and also I'm going to touch a little bit about the treatment of asthma. So what is asthma? So asthma actually stands for noisy breathing in Greek language. Yeah. So it is an obstructive airway disease, and it is chronic, long-term lung condition that can cause coughing, wheezing, and breathing problem for those who have this condition. So what is asthma? It is actually also the most common chronic disease among children. So it causes airway to become inflamed and narrow, and hence it causes difficulties in breathing. And then it can affect people of all ages, but usually it starts during childhood. Adult can have asthma as well, but when we see adult with so-called asthma, we need to see whether or not they really have asthma versus what we call COPD, chronic obstructive pulmonary disease, which is a separate, different entity. So how asthma affects your lung? As you can see from this cartoon here, the normal lungs look like this, yeah, on the left-hand side. So the little air sacs, the little bubbles there are called the alveoli. Yeah? So air exchanges actually happen in all these little air pockets inside our lungs. But when a person have asthma, then the airway will become inflamed and filled by excessive mucus. So the airway is actually blocked in the situation of asthma. So that's why it causes a lot of difficulty in breathing. So I'm going to show you some statistics, and these statistics are quite scary actually. So in the world, it affects an estimated 262 million people worldwide and caused a whopping 500,000 deaths in 2019. So that's a lot. Yeah, 500,000 people die because of asthma in the year of 2019. And most asthma-related deaths occur in low and lower middle income countries where underdiagnosis or undertreatment is a challenge. Mm. So how about Malaysia? Yeah. So in Malaysia, 1,000 people die of asthma alone in 2020. So that's 0.6% of total death. So to put in a perspective for you, one in about 160 deaths in Malaysia are those people who died from asthma. And this is actually quite scary because death from asthma is totally preventable. 7.1% or about 1 in 14 children under the age of 18 years old in Malaysia have asthma. That's a lot. Yeah, that's a lot. So diagnosis of asthma. So of course you cannot, make a firm diagnosis of asthma by yourself. But if you have all those symptoms, you need to see the doctor. The doctor will do a host of tests, yeah, including some baseline blood tests, yeah, and then most importantly, they'll do a lung function test to definitively diagnose asthma. So how about asthma attack? Yeah, or during an asthma attack, the person will feel cough or wheezing. They'll feel tightness at the chest area. They'll feel that their breathing speeds up. Yeah, they're breathing faster but shallower. Not to say they are breathing fast but deep. Yeah, they are breathing fast and shallow. So there's no or there's not adequate air exchange. Yeah, when you're breathing fast and shallow. So the patient will feel short of breath. Yeah. So how about severe asthma attack? So to get more severe than that, than the previous slide, in addition to the symptoms I just mentioned, severe asthma attack will cause the person to be unable to even eat, speak, or even sleep. Yeah? So they'll feel that their heartbeats get faster, yeah, and they might have some blue lips or fingers because of inadequate oxygen intake by the lungs. And then the patient can start to feel dizzy, drowsy, and even they can get confusion or feel exhausted. And the person can actually faint, followed by death, yeah, during severe asthma attack. So there's not something that we can actually take it lightly. So signs of, just now, those are the symptoms of severe asthma attack. But how about signs of severe asthma attack? So when the person who has asthma has more frequent visiting to the hospital, especially to the emergency room with asthma attack, and then they are using quick relief medicine for more than 2 times per week, or needing a new inhaler, or they are needing steroid pills for more than 2 times a year, and also some of those might have difficulty with everyday activity. Like I said, they couldn't even speak, eat, or sleep due to constant asthma attack. So all these are signs of severe asthma that warrant attention. So you always need to work together with your regular doctor. Most of the doctors can treat asthma, general practitioner can treat asthma, but if you have the luxury of seeing a specialist, of course, a respiratory physician would be the best person to handle your asthma. Yeah. So I'm going to give you an example. So a lot of people think that the treatment of asthma is just going to use the blue inhaler, yeah, the Ventolin or the albuterol inhaler. That's actually a very wrong concept. So like I'm pointing out here, if we are using quick relief medicine for more than 2 times per week, that's considered inadequately controlled asthma already. Yeah, I've seen people, some people they thought, well, all they can do is just, the blue little inhaler. That's wrong. Some of my patients, when I see them, they are using the blue inhaler 1 time every few hours. So that's really bad. Because like I mentioned here, if we are using this so-called quick relief medicine for more than 2 times per week, we are considered inadequate control asthma already. So what about complications of asthma? So as I mentioned earlier, this is not only an acute condition. If we have uncontrolled asthma, this condition will become chronic, and then a lot of chronic complications will arise, include constant fatigue, low exercise tolerance. So maybe the kid who have asthma is not able to play the sport, just like their peers. Yeah, they get very short of breath with the same amount of exercise that their peers are doing. So some people get frequent sick leave. Yeah, and we are losing a lot of school days because of this uncontrolled asthma, hospitalization, pneumonia, yeah, and even lung scarring. As I mentioned, asthma, most people with asthma, will have narrowing of their airways and then inflammation, giving rise to all the excessive mucus, plugging the already narrowed airway. So if we don't get treated, they'll start having pneumonia, and then bouts of pneumonia is going to create lung scarring, which is not reversible. Yeah. So we have to try to prevent that from happening. And of course, when we have lung scarring because of pneumonia and uncontrolled asthma, sooner or later the person will have respiratory failure, and some people can even die from asthma, like I mentioned just now. People who die from asthma can be dying from acute asthma attack or uncontrolled asthma, giving rise to chronic complication. So many of you maybe do not know this person, but your parents would know this person, believe me, or your parents' parents. Yeah, she's a very famous singer from Taiwan, but she's extremely famous during her time. And unfortunately, she died of asthma at just the young age of 42 years old. Yeah, this is totally preventable, unfortunately. So I'm going to give you a very quick overview or review regarding the treatment of asthma. Yeah. So I'm going to talk a little bit about the aim of treatment of in chronic asthma, and then I'm going to just introduce to you this so-called rescue inhaler or quick relief inhalers. Most of us call it rescuer or reliever, puffer or inhaler. So the word puffer is the same with inhaler, yeah, for asthma purposes. And then we have this preventive long-term medication, what we call the controller or the preventer. And I'm going to touch a little bit about how do you take your asthma medication, yeah, and then I'll mention about asthma nebulizer, side effect of asthma medication, how to avoid asthma triggers, and asthma action plan. Yeah. So aim of chronic asthma management, not only we want to try to achieve current control, but we want to control asthma so that we can reduce future risk of having respiratory failure, pneumonia, lung scarring, and all those untoward complications like I just mentioned. There are multiple scheme or multiple questionnaire that you can pick up from the internet, and it will give you some idea regarding whether your asthma is adequately controlled or not. So you can try this. You can just Google asthma control test, and then answer the questionnaire. A score of less than 19 means your asthma may not be under control. So if your asthma is not under adequately control, then you really need to work with your doctor. And if your doctor is a GP who is, not able to control your asthma, he or she may need to refer you to a respiratory physician. So this one, I think I mentioned a little bit about this one already. So I'm going to show you this cartoon here. So this one is a normal airway. Yeah, it's a cross-sectional diagram, just like when we have an airway and we cut into half, and this is what you see. During asthma attack, you have swollen airways, including excessive mucus plugging inside the airway. And after the medication, most of the time we restore the airway, meaning that we are going to take care of the inflammation. The mucus will be less, and the airway will be dilated back, yeah, to normal or near normal caliber of the airway, like just before the attack. Mm. So treatment of asthma, like I mentioned, we have got three distinctive but somehow overlapping categories of inhalers. One is what we call reliever or rescuer, another one is controller, and the third one is preventer. So reliever or rescuer just means that when a patient is having severe asthma or asthma attack, yeah, they need to use this medication in order for them to restore their normal breathing. Yeah. So when a patient has a very tight airway already and we don't do anything about it, it will lead to severe complication. Yeah, like just like what I mentioned just now, dizzy. If they don't get enough oxygen, they'll get confused, drowsy. They might faint and they might die. So first of all, we have the reliever or the rescuer inhaler. Yeah, the most common one is the Ventolin. Yeah, the salbutamol, the so-called the blue inhaler. So this blue inhaler is actually quite standardized. Yeah, Ventolin is just one of the original brands, and salbutamol has a lot of different generic brands. But all these generic brands usually they are using blue color code. Yeah, as the color of their inhaler. So you can recognize it very easily. Another one that we commonly use is Atrovan. Yeah, Atrovan is actually an anticholinergic. It serves almost the same function like the short-acting beta agonist, for example, the Ventolin, to open up the airway. Yeah, but this too doesn't do much to reduce the inflammation. So when a person is having a acute attack of asthma, sometimes in addition to trying to use these two medications to open up the airway, we want to reduce their inflammation. And we can actually achieve that by giving a short burst of oral steroid or IV steroid injection. Yeah, especially when the patient is having severe asthma until they need to land up in the hospital. We can use nebulizer as well, but again, nebulizer or the injection of steroid are usually used in these are emergency what we call the or some GP or clinics may have it. So how about controller? So controller and preventer, nowadays they are overlapping already, yeah? Because, when a person is having inadequately controlled asthma, the next medication that your doctor would give you would usually be a combination of long-acting beta agonist and also a steroid. So it is actually a combination of controller and preventer already, yeah? Last time before they have all these, overlapping inhalers, people with asthma might need to use two or three inhaler, but actually things are much easier nowadays because, as I mentioned, they have got this overlapping combination inhaler. So sometimes we do need to give a oral medication, for example, Singular, or one of the brand names is Montelukast, to prevent or to minimize the chance for a person to have a relapse of asthma. So this is preventer. Yeah, as I mentioned, a lot of time people are using a combination of controller and preventer already, in addition to their rescuer. So this is a diagram which is a good summary of treatment available. So again, you have the reliever, you have the controller, you have the preventer, you have the combination, which is almost like a standard of practice now. Yeah. So I just want to mention here, reliever and rescuer should be used as needed basis. So when you need it, then you use it. But your controller, your preventer, or your combination medication, or your oral Montelukast or singular medication needs to be taken on a daily basis or twice a day, depending on how the prescription is written by your doctor. So the controller and preventer should not be used only when you need it. Yeah. Because if your asthma is severe enough to need controller and preventer, then you need a better control by using this medication regularly. How to use inhaler? So actually, I'm not going to go through, all the writings in this diagram. Yeah. Nowadays, technology make it so easy for us. If you, let's say, if you forget to ask your doctor or your pharmacist how to use the inhaler appropriately, then just try to Google it, yeah, or try to go to YouTube. Yeah, just search, how to use your type of inhaler appropriately, and they'll have all this video demonstration. But of course, having seen all this video and you're still in doubt, you can still go back to your pharmacy or your doctor to teach you again. Yeah. So asthma nebulizer is a lifesaver, basically. So this is usually available in emergency room, or some GP also have, some general practitioner also have this in the clinic. So it's a small device that convert the drug from solution for aerosol form, and it can actually be given and delivered to the lungs via a face mask. Usually the content is either Ventolin or Atrovan or combination. Okay. So how about the side effect of inhalers? Sometimes we can have oral thrush, which means a very fungal infection that happens in our mouth. Yeah, the manifestation is whitish, sticky patches in the mouth that you can actually scrape it, with a tongue scraper. Yeah, so those are oral thrush. We can have nasal congestion, sinus pain, headache, and even some dry cough or sore throat, yeah, when we are using our inhalers. Yeah, these are the very, very common side effects. And then this can be prevented or minimized by regular and careful mouth rinsing after the use of your inhalers. So this is a big one. Avoid asthma trigger. Everybody is different, but usually these are the common triggers. So exercise, I'm not going to ask you not to do exercise, but just know your body the best. Yeah, know your body well. At what level of exercise you should do. To build up your lung capacity. But at what level of exercise you should avoid if you know that that particular level of exercise will trigger your asthma attack. Yeah. So always have to find a balance. Yeah. So pollen, some people can be allergic to pollen, or pollen can trigger an asthma attack. Some pets, yeah, the fur of the pets, stress, anger, pollution, strong odors, smoke. Yeah, sometimes some people are having adequately controlled asthma, but their neighbor is undergoing renovation. So all the dust travel by the air to the house, and then the person can have asthma attack. Yeah. So some people can actually use air purifier. Yeah. So dust, fungal spore, cold air, chemical fumes, insects, and the list goes on and on. Yeah. So some people, I'm going to tell you a story. I personally have asthma. Yeah. So my trigger are none of this, but my trigger was pickle. Yeah. You know what pickle is, right? We call it jeruk in Bahasa Malaysia. So I was given a bunch of jeruk Penang by my sister who traveled to Penang, and I have a very, very, very bad asthma attack. Yeah, after I consume it. Yeah, so I think just be careful because things can be an unpredictable trigger for your asthma. Right? So asthma action plan. So again, all these are available on the internet. Yeah. I think for those of you who have asthma, or if you think your asthma is not adequately controlled, in addition to the survey I was talking about just now, maybe you should just try to find one of these asthma action plan. So whether your asthma is adequately controlled, whether you should exercise caution in the middle category when you are actually having some of these symptoms already, or whether you need immediate help. Yeah. if you belong to the red category. Yeah? All these are easily available on the internet, so just make use of them. Yeah? So take-home messages, this is going to be my last slide. So asthma is a major non-communicable disease and is affecting both children and adults. Inflammation and narrowing of the small airways in the lungs cause asthma symptoms, which can be any combination of cough, wheezing, shortness of breath, chest tightness, and so on. So medication can be used to control asthma symptoms and allow people with asthma to lead a relatively normal and active life. Again, you should need to find a balance. Yeah, um, um, don't need to prevent exercise just to avoid asthma, but try to exercise to build up your lung volume. But at the same time, try to know, what level of exercise, what level of activity will, become a trigger of your asthma. Always try to, get that balance. So you need to try to avoid asthma trigger by trying to identifying it. Yeah. So should always have an asthma care plan in place. And I need to mention to you again that untreated or inadequately controlled asthma can lead to a lot of untoward long-term complications like hospitalization, pneumonia, lung scarring, respiratory failure, and even death. So it's very, very important for you to work together with your doctor, your pharmacy, and so on, yeah, to make sure you're on the right asthma and medication and you're using all these asthma medication correctly, yeah, which is equally important. So with that, I thank you for your attention.